All right, let's get right into it. Today, we're breaking down a protocol that could literally change the game for first responders in Arizona, especially when you're staring down a hazmat scene with a ton of potential exposures. This is all about making your job safer, smarter, and way more efficient.
So, picture this. You're on scene at a chemical leak. People are everywhere. Some are coughing, some are complaining about skin irritation, and a whole lot of them are just plain scared. The old playbook says start transporting. But what happens when you've got, say, 50 people? Are you really going to tie up every ambulance in a 10-mile radius to shuttle them all to one ER? And that right there is the dilemma. It's a total logistical nightmare. Your local hospital gets completely overwhelmed. All your units are stuck on transports for hours, and you're spending critical time dealing with the worried well, folks who need reassurance but maybe not a full-blown emergency room workup. For years, the approach was, well, kind of brute force, right? If you might be exposed, you get a ride. But we now know that just clogs the whole system. The new way is so much smarter. It's about a better triage, a system that lets us manage those low-risk cases with experts following up remotely. This frees up our precious resources for the people who are truly in danger. Now, this new approach isn't just some vague idea. It is a formal, honest-to-goodness protocol. It's called the AZPDIC Non-Transport Protocol, and it comes from the Arizona Poison and Drug Information Center. This is the specific tool built to keep our emergency response system from grinding to a halt during a crisis.
So, what does this actually mean for you on the street? It's a medically approved system that gives you, the responder, the green light to release low-risk patients. They don't just disappear, though. They get direct, remote follow-up from poison control experts. And let's be crystal clear, patient safety is the #1 priority here. We're just making the whole response way more efficient.
Okay, so this sounds great, right? But the big question is, who exactly fits the bill? When you're standing there on a chaotic scene, how do you know who qualifies for this non-transport option?
First up, you've got your low-risk exposed. Think about someone with a mild cough, maybe some minor skin irritation, or a bit of a headache. After you consult with the experts, it's determined they're pretty unlikely to get seriously sick. They still need to be monitored, for sure, but they probably don't need to take up a bed in the ER.
And this is brilliant. This is how we handle the worried well. You know, the people who were nearby feel perfectly fine, but are understandably freaking out. This protocol gives them a direct line to an expert for reassurance and follow-up instructions. That's often all they need, and it keeps your ambulance free for the next call.
Now, here's a huge benefit that I think is incredible. This protocol also covers you, the responders. Yep, personnel on scene can get added to the same follow-up list for occupational monitoring. This is a huge deal, especially for agencies that might not have their own formal program. It makes sure every single responder gets documented follow-up with a toxicology expert. All right, so we know who can use this. Now, how do you actually do the handoff? Well, it's a really clear, simple procedure that was designed to be used in the middle of a chaotic scene. The whole thing basically boils down to one single phone call. The EMT or paramedic on scene gets on the line and patches in 2 other people, the AZPDIC toxicologist and their own EMS medical director. You're all on one call. You just present the case, give the patient's name and number, and boom. The handoff is done. It's that straightforward.
It is super important to remember that this protocol is part of a much bigger HAZMAT response plan, and there are very specific triggers that mean you have to call AZPDIC whether you plan on transporting anyone or not.
Think of this as your mandatory call checklist. You got confirmed exposures? You call. You're decontaminating civilians? You call. You transport even one patient to the hospital? You call. You crack open a state chem pack or a local tox box? If you check any of those boxes, a call to AZPDIC is required. No ifs, ands, or buts. Okay, everyone, get your phones out. I'm serious. This is the single most important piece of info in this whole breakdown. This is the number. Go ahead and pause, take a picture, save it in your contacts right now. This is your direct line to get toxicology experts on your team in minutes.
And please, listen to this warning. It is absolutely critical. Do not use the regular 1-800-POISON control number for this specific program. Using that wrong number will get you tangled up in delays and confusion when every second counts. You have to use that direct 520 number.
So, what happens if you make the call and the toxicologist on the other end says, "Nope, this patient actually needs to be transported"? No problem. The protocol has a plan for that. The next step is clear.
You call Banner University Medical Center in Tucson, or BUMCTC, and get further direction. It's a completely closed-loop system. No one gets lost in the shuffle.
You know, when you put all these pieces together, what you're really looking at is a smarter, more nimble future for emergency response. It's all about using technology and expert consultation right there in the field to give better patient care and manage our resources more effectively.
So, at the end of the day, this protocol is much more than just a new rule. It's really a new way of thinking about triage. It proves that when we bring expert help directly to the front lines through telemedicine, we can build a system that's safer and way more efficient. Which leaves us with one final thought. If we can transform HAZMAT response this way, what other parts of our job, from MCIs to everyday calls, are ready for this kind of thinking?